Okay, so I've entered the room and washed my hands, and I'm ready to introduce myself to the patient. Hi, my name is Kirsten. I'm going to be doing a head-to-toe assessment on you today. Could you please tell me your name and date of birth?
Jeremy 9/17/2000.
Perfect, thank you. So I'm going to first start with a general survey of the patient. The patient does not appear to have any signs or symptoms of distress. He is well nourished, appropriately dressed for the weather, and appears to maintain good hygiene. I'm going to move on now to an assessment of the head and skull. The skull is symmetrical bilaterally. There's no visible signs of lumps, masses, or lesions. Hair is evenly distributed. No signs of thinning or balding or discoloration. Okay, so now I'm going to do some light touching of your scalp and skull. Let me know if you feel any pain or tenderness. Any pain? All right, so no pain reported upon palpation. No lumps, masses felt, no abnormalities of the skull, scalp, or hair noted. Now we're going to move on to your face and be looking at your facial bones and do some light touching. So facial features, eyes, nose, mouth, ears are all symmetrical bilaterally. No visible lumps, masses, or lesions or abnormalities. I'm going to do some light touching. Let me know if any of this is painful. Any pain? No pain reported upon palpation. No lumps or masses noted. Now I'm going to move on to an inspection of your eyelids. If you could close your eyes for me. So eyelids are symmetrical, eyelashes evenly distributed and present on both eyes. No visible drainage noted. No lumps or masses noted. No erythema noted. Go ahead, open your eyes again for me. Close them really tight. Okay, you can open them one more time. If the patient is able to open and close eyes without difficulty, no signs of ptosis noted. Now I'm going to go ahead and open. I'm just going to pull down your eyelid here. Right, so the conjunctiva is clear, the sclera is white, cornea does not have any visible blood vessels present. Iris has similar coloring and patterning in both eyes, all symmetrical bilaterally. No orbital swelling noted. Now I'm going to move on to a more in-depth examination of your eyes. Go ahead and look straight ahead for me. I'm just trying to light in your eyes. And so pupils are equal, round, and reactive to light. Consensual response is present. Go ahead and follow my pen light for me. And then back out. Right, accommodation is also present. Now I'm going to take a look at your inner eye here. With this. Okay, go ahead and focus on an object in the distance for me. I'm just going to shine a little light in your eyes here. Perfect. So red light reflex is present in both eyes. All right, so optic disc is creamy yellow in color, with sharp, well-defined margins, approximately 1.5 millimeters in diameter. The fundus is yellow in the background, with no lesions or hemorrhages noted. The cup and disc ratio is within normal limits, with no signs of glaucoma, no clouding of the lens is present, and there is no signs of cataracts. So now I am going to shine a light in between your eyes here. All right, so light is reflected equally, symmetrically from both eyes. The corneal light reflex is intact. Now we're going to do some more tests to kind of further assess your vision. So focus on this for me. Cover your left eye. Perfect. Okay, go ahead and take your hand down. Focus on this, and then cover your right eye. Right, good. So No movement is noted in the covered or uncovered eye. Now I'm going to have you look directly at me. I want you to cover one of your eyes, and then tell me when you can see my finger. Make sure you look just at me.
Yes. Yes.
Sorry.
Yes. 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 Yes.
Switch sides. Same thing. Straight at me.
Yes. 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 Yes.
All right. So peripheral vision is intact. Confrontation is intact. Now go ahead and follow this sunlight for me. All right. So 6 cardinal fields of gaze are also intact. No nystagmus or ptosis noted. Now I'm going to have you cover up one of your eyes for me. Okay, and then read the smallest sign you can.
L T F P H.
Okay, good. Now switch sides. Same thing.
L T F P H.
Right, so patient's vision is 20/20 without corrective lenses. Now I'm going to move on and we're going to be assessing your ears. So first I'm just going to take a look. The ears are in alignment, no visible masses. Lumps or abnormalities noted. There's no visible drainage. I'm going to do some light touching. Let me know if any of this hurts. Any pain?
No.
All right, so no pain reported upon palpation. The article and pretragus are firmly mobile. Again, no lumps or masses noted. Now I'm going to take a look inside of your ears here. I'm just going to pull back here slightly. Alright, so the auditory canal is pink, no erythema noted, minimal cerumen present. Tympanic membrane is pearly gray, translucent, no bulging or retractions noted. Cone of light is present at 5 o'clock in the right ear. Alright, so auditory canal is pink, no drainage, erythema lesions present, minimal cerumen present. Tympanic membrane is translucent, pearly gray in color, no bulging or retractions noted, and the cone of light is present at 7 o'clock. Now we're going to move on to your nose. We're just going to take a look. The nose is symmetrical. Nares are symmetrically positioned. No visible deformities or lumps noted. Now I'm going to do some light touching. Let me know if this is painful. Any pain? All right, so no pain reported upon palpation. No lumps noted. No bone displacement or cartilage displacement noted. I'm going to check your patency of your nose. Go ahead, plug one nostril for me. Take a deep breath. And switch sides. All right, so the patient has noiseless, easy breathing. Patency of the nose is intact. Now I'm going to take a peek inside your nose. If you could just tilt back for me. And other side. All right. So the nasal turbinates are pink and firm, glistening with the septum close to midline. Inferior middle terminates were visible, and again, septum was close to midline in both. Now I'm going to move on to an assessment of your mouth. I'm going to look at your lips. The lips are pink and smooth, symmetrical horizontally and vertically. No cracking, lesions, or bleeding present. Now I'm going to go ahead and take a look inside your mouth if you could open for me. Right. The buccal mucosa is pink, smooth, and moist. go ahead, tilt your head back. I'm gonna look at the top of your mouth. Hard palate is white shaped, white colored and dome shaped, contiguous with the pink soft palate. The pink soft palate rises and falls symmetrically with the uvula, midline. The tongue is smooth, reddish in color, no lesions present, appears to be midline. Go ahead, lift up your tongue for me. And the floor of the mouth is pink and smooth and moist. All right, now I'm going to take a peek at your teeth. Okay, all right, so teeth are ivory, no signs of dental caries, teeth interlock correctly. The patient does not have any missing teeth. Gums are pink and smooth, no signs of inflammation or bleeding. So I'm going to open up one more time and stick out your tongue for me. Down. Right, so uvula again is midline. Tonsils are present, pink and moist. No signs of swelling or exudate noted. Posterior pharynx, pink and smooth, no erythema present. Okay, now I'm going to have you take a drink of this water for me. I'm going to check your swallowing here. Right. So patient swallowing is intact, no gagging, choking noted. Now I'm going to check out your jaw. I'm going to do some light touching. Go ahead and open. Any pain? Those? Right, so no pain, crepitus, popping or locking noted upon palpation. Clench your teeth for me. Any pain? No. Right. So, no signs or symptoms of TMJ present. I'm going to move on to an assessment of your neck and your skin there. So the skin on the neck is intact, no lumps or lesions noted, no visible abnormality. The muscles on the neck appear to be symmetrical bilaterally. Now I'm going to check the range of motion in your neck. If you could turn side to side for me. Okay, tilt your chin to your chest. Put your head all the way back. Good. Ears to your shoulders. Good. All right, so neck range of motion is intact. So now I'm going to move on and check the arteries and veins in your neck. If you could go ahead and lay down for me. All right, I'm going to have you tilt your head to the side. Okay, check out your veins here. All right, okay, switch sides, look at me. All right, so the venous pressure should be less than 9. No signs of distension or bulging. JVD is not detected. So now I'm going to just feel your carotid pulses here for your arteries. Okay. Okay, pulses are 2+ regular rhythm, symmetrical bilaterally. I'm going to take a listen. Right, so no thrills or bruits detected upon auscultation of the carotid arteries. So now I'm going to take a look at your trachea. If you could go ahead and sit up for me. Take a look. Do some touching. Go ahead and swallow for me. So the trachea is midline. No displacement noted. No thyroid enlargement noted. Now I'm going to move on to an assessment of your lymph nodes. So I'm just going to be doing some light touching. First, start with the preauricular nodes, postauricular, occipital, tonsillar, submandibular, submental, the superficial cervical chain, posterior cervical chain, deep cervical chain, and then supraclavicular, lymph nodes. None of the patient's lymph nodes are palpable. So now we're going to move on to the assessment of your chest. So first I'm just going to be taking a look at your skin. So skin is intact, coloring is even, there's no lesions, abnormalities, lumps, or visible mass is present. Posterior and anterior chest appear to be symmetrical. The patient is not showing any signs of dyspnea, accessory muscle use, retractions or heaves. Anterior and posterior, I already said that, chest are symmetrical. AP diameter is approximately 1/2 that of the transverse diameter. Now I'm just going to take a look at your spine here, do some feeling. All right, so the spine appears to be in alignment. No lordosis or kyphosis noted. The curves in the cervical and lumbar spines are concave. There is no tenderness or muscle spasms noted upon palpation. Again, no lumps or masses noted upon palpation of the spine. So now I'm going to move on to the assessment of your lungs. So I'm actually going to have you scoot to the edge of the bed here. Oh, like right there. Oh, yep, like that. That's perfect. All right. So first I am going to place my hands on your chest and I want you to say 99.
99. 99. 99. 99.
All right, so fremitus is present and variable throughout, but symmetrical bilaterally. So now I'm going to have you do the same thing, but I want you to say 99 as I put my stethoscope on you.
99. 99. 99. 99. 99. 99. 99. 99.
All right, so the sounds are muffled and indistinct throughout, no signs of bronchophony noted. So now I'm going to just listen to your lungs, so I'll have you take a deep breath when I say deep breath. 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 And one more time. The lung sounds are clear throughout, no adventitious breath sounds noted. Lung sounds are symmetrical bilaterally, mostly vestibular lung sounds noted throughout. Now I'm going to be doing some light tapping on your lungs. You may just breathe normal. All right, so percussion is resonant over all areas of the lungs. So now while you're also sitting up here, I'm going to assess for some tenderness in your kidneys. Turn like that. There we go. All right, so tell me if this hurts. So no CVA tenderness noted. Now I'm going to be moving on and we're going to be assessing your heart. Again, inspection of the chest was within normal limits, all symmetrical, no abnormalities noted there. So I'm going to be listening to your heart with both sides of my stethoscope, first with you sitting, lying, and then on your left side. Turn towards the camera a little bit. There. Okay. All right, so first I'm going to start in the second right intercostal space over the aortic area. S1 and S2 heard. S2 is louder than S1. Now move to the left second intercostal space over the pulmonic area. S1 and S2 heard. S2 louder than S1. Now we'll do the third left intercostal space over Erb's point. S1 and S2 heard. S2 louder than S1. the fourth left intercostal space over the mitral area. S1 and S2 heard. S1 is louder than S2. And then finally the fifth left intercostal space over the tricuspid area. S1 and S2 heard. S1 louder than S2. No abnormal heart sounds or murmurs were noted. So now I'm going to do the same thing with the other side of my stethoscope here. Again, S1 and S2 heart sounds heard. No abnormal sounds or murmurs were detected. Right, so now I'm going to have you go ahead and lie down on your back. I'm going to do the same thing. So S1 and S2 heart sounds again heard with no abnormal sounds or murmurs noted. Switch sides here. Nope, sorry, this one. One more time. Okay, so S1 and S2 heart sounds heard, no abnormal sounds or murmurs noted. Now I'll go ahead and enter on your left side. And then so S1 and S2 heart sounds heard, no abnormal sounds or murmurs noted. And then finally, right, so S1 and S2 heart sounds heard, no abnormal extra heart sounds or murmurs noted on the cardiac exam. So now I'm going to be feeling, so go ahead and lay on your back. I'm just going to do some touching here. Go for any abnormal. All right, so no thrills or heaves noted upon palpation. Point of maximal impulse is palpable, gentle, brief impulse with no thrills or heaves noted. Go ahead and I'll have you sit up towards the edge of the bed again so I can check your pulses. So first I'm going to check your radial pulses. All right, so radial pulses are 2+ symmetrical bilaterally. Rate is regular. I'll feel your femoral pulses. Femoral pulses 2+ regular symmetrical bilaterally. So I'm going to feel your Salus pulses. Regular rate 2+ symmetrical bilaterally, and then your posterior tibial pulses. Again 2+ regular rate symmetrical bilaterally. Now we are going to move on to the assessment of your abdomen. If you want to lay down for me again. Perfect. All right, so first I'm just going to be inspecting. All right, so the abdomen is flat, skin coloring is even, no visible lumps, masses, or protrusions present. And now I'm going to go ahead and just listen. Breathe normally. I would listen for up to 5 minutes if no bowel sounds were heard, or up to a minute to determine if bowel sounds are hyperactive. However, bowel sounds are normal active in all 4 quadrants. Now I'm going to, while you are lying down, listen to the arteries in your abdomen. Aortic, iliac, renal, and femoral. Alright, so no bruit or friction rubs noted upon auscultation. Now I'm going to do some light tapping on your abdomen. Right, so tympani is predominant throughout. And now we're going to do some touching to feel for masses or pain anywhere. Let me know. Any pain? Right, so no tenderness reported upon palpation. No masses, bulges noted. There's no pain noted upon palpation of McBurney's point. That is negative. I'm going to have you go ahead and lie on your left side. And I'm going to have you flex back your right leg. Flex your butt cheek. There you go. Is that painful?
No.
So a sign is not present. Go ahead and lay on your back. And I'm going to flex up this knee. Any pain? No? This one? Alright, so obturator sign is also not present. Pain was not noted upon palpation. So pain was not reported upon palpation of the lower quadrant, of the lower left quadrant. The Robson sign is not present. Also cessation of inspiration upon palpation of the gallbladder was not present. So the Murphy sign was also not present. Now I'm going to do some touching on the left side of your rib cage. Any pain? No. The spleen is not palpable. No pain or tenderness noted upon palpation. And I'm going to do some light tapping again just to check for the size of your liver. Alright, so liver is approximately 7 centimeters at the mid-clavicular line. While you're lying down, I'm going to check the lymph nodes here at your groin. Right, so the inguinal lymph nodes are not palpable. Now we are going to go ahead and move on to your neurological system. So you can go ahead and sit back up for me. If you can set the bed again. Yeah, okay. So as previously assessed, we already assessed the patient's nasal patency is intact. Now we're going to assess your sense of smell. Go ahead and plug one nostril for me. Okay.
11.
Okay. All right. Okay. Plug the other one.
Yeah.
Perfect. All right. So the patient correctly identified both smells. The olfactory nerve at the cranial nerve 1 is intact. Go ahead and cover up one of your eyes for me and look straight at me. Tell me how many fingers I'm holding up.
2, 3, 4, 2.
Okay. Switch sides.
2, 4, 3,
Okay.
2.
Perfect. So visual field is intact, and as previously assessed, the optic exam was within normal limits. So cranial nerve 2, the optic nerve is intact. Now I go ahead and follow my pen light for me again. Right, eye movements are symmetrical. Again, no nystagmus or ptosis noted. Cranial nerve 3, ocular motor nerve. Cranial nerve 4, the trochlear nerve, and cranial nerve 6, the abducens nerve, is intact. So now I'm going to have you close your eyes, and then I want you to tell me if this feeling is sharp or dull. So this is sharp, this will be sharp, this is dull. Okay?
Dull. Sharp. Dull. Sharp. Dull.
All right, so patient is able to correctly identify sharp and dull sensation. Go ahead and clench your jaw for me. Okay, move it laterally. Yeah, there you go. Open, close. Jaw movement is also intact. So the cranial nerve 5, the trigeminal nerve is intact. Go ahead and clench your teeth for me. Squeeze your eyes shut. Raise your eyebrows. Wrinkle your forehead. Puff out your cheeks. Stick out your tongue. Lift up your eyebrows. What are you doing? So facial movements are symmetrical. Cranial nerve 5, the trigeminal nerve, and cranial nerve 7, the facial nerves are intact. Now we're going to assess your hearing. So I'm going to have you plug one side of your ear. I'm going to whisper 3 things, and I want you to repeat them.
1, 6, 8.
Okay, which sides?
W, 7.
Okay, so whisper test is normal and intact. Now I'm going to take this tuning fork and hold it over your head. I want you to tell me if it's the same or different sounding and when it stops. Okay? Sound the same or different in your ears.
Same.
Good. And tell me when you don't hear it anymore.
I don't hear it.
Good. Okay. So Weber test is within normal limits. Now again, I want you to tell me when you stop hearing the sound.
Stop.
Okay. You still hear it?
Yeah.
Did it stop?
Yes.
Same thing on the other side.
Stop.
Okay. What about now?
Stop.
Good. Okay. So the Rhine test is also intact. Patient's hearing is intact. So vestibular cochlear nerve, cranial nerve 8 is intact. As we previously assessed, patient's swallowing is intact. Now I'm going to move on and check his gag reflex. Go ahead and open for me. Stick out your tongue. All right, gag reflex is intact. Speech has been clear throughout the examination with no slurring or difficulty noted. Oral assessment was also previously intact, uvula and tongue both midline. So cranial nerve 9, the glossopharyngeal nerve, and cranial nerve 10, the vagus nerves are intact. All right, so now go ahead and shrug your shoulders for me. Shoulder shrug is symmetrical. Resist me. All right, strength is 5 out of 5. Symmetrical bilaterally. Cranial nerve 11, the accessory nerve is intact. Go ahead and stick out your tongue for me. Pull it up, pull it down, move it side to side. Tongue movement is symmetrical, smooth, and easy without difficulty. Say LT and N for me.
LT and then.
Good. So speech is clear. Again, no difficulty noted. Again, no difficulty in swallowing assessments. So cranial nerve 12, the hypoglossal nerve, is intact. Now we are going to move on to, we're going to check balance. So go ahead and stand up over here for me. Okay, so shoulders on your sides, feet together. All right, go ahead and close your eyes for me. Good. So no swaying or staggering noted. Patient's balance is intact. You can go ahead and open for me. So you can go ahead and just walk back and forth for me. Just check out your gait. Patient has a smooth, regular gait, symmetrical stride, no shuffling or difficulty with mobility noted. Now we are going to walk heel to toe, forward and back. Good, and then backwards. All right, Contact between heels and toes is consistent. No instability or staggering noted. Now I'm going to have you, you're going to touch your nose, alternating fingers as fast as you can. Good. Right, so movement is smooth, rapid, and accurate. No difficulty noted. Now I'm going to have you touch your fingers, alternating. Good. Again, movement smooth, rapid, and accurate. No difficulty noted. All right, you can go ahead and take a seat for me again. All right, I'm going to check your grip strength. So grip my fingers for me. Strong. All right, so grip strength 5 out of 5, symmetrical bilaterally. Go ahead and open up your hands, close your eyes, and I'm going to draw something in your hands. I want you to tell me what it is.
A. M.
Good. Right, so patient correctly identified both things drawn in his hands. Graphesthesia is present. Now I'm going to place an object in each one of your hands. I want you to identify that for me. Okay, so close your eyes. Tell me what this object is.
A key.
Good. Tell me what this object is.
Paper clip.
Good. The patient is correctly able to identify both items placed in his hand. Stereogenesis is present. Again, speech has been clear throughout the examination. No slurring or word finding difficulties are noted. Now I'm going to have you take your heel, rub it up and down your shin for me. Good. Movement is straight, without difficulty. Yep, switch sides. Again, movement is straight, no difficulties noted. Now I'm going to have you, okay, I'm going to have you make it, put up one of your hands like this, okay? Now I'm going to pull and you need to resist me. Resist. Resist. Okay, now push. Push hard. Okay, push hard. Okay, switch sides. Okay, pull. Pull hard. Pull hard. Okay, push. All right, good. All right, so rebound phenomenon is not present. The findings are normal. Now I am going to, oh, I need to lay down one more time. I'm going to check the reflex in your feet. Oops. Good. All right, so Babinski reflex is negative in both feet. All right, I'm going to have you sit up again so I can check out your reflexes. So first we are going to start with the triceps. Okay, switch sides. Good. Now your brachioradial. Good. Good. All right, your triceps, go ahead and bend your arm, try to just relax for me. Okay. Good. Okay, now I'm going to do your knees here. Nope, just relax your legs. Good. Good. Okay, and then your Achilles. Good. All right, good. So reflexes are all intact, no hyperreflexivity noted. Now we are going to inspect your upper and lower extremities. Upper and lower extremities are symmetrical, no visible abnormalities noted, skin coloring is even. Hair is present in expected areas and evenly distributed. I'm going to take a look at your nails here. All right. Longitudinal ridging is present. Yeah. Clean and intact. Longitudinal ridging is intact and present. Nails are clean and dry. Let me check the capillary refill here. Right, capillary refill is less than 3 seconds in upper and lower extremities. Now I'm going to look at and do some feeling on your joints. Joints are symmetrical, no swelling or erythema noted. Any pain? No pain upon palpation. Again, no visible deformities noted. Now we are going to assess for range of motion in your upper and lower extremities. Go ahead and stand up for me. Okay, stick your arms out and back. Move in a circle. Out and in. Okay, bend your elbows. Good. Rotate your wrists. Perfect. Kick out your leg for me. Back. You can step out, sorry. Yeah, side to side. In a circle. Okay, other leg. Out. Back. Side to side. Circle. Bend your knee up for me. Other knee. Ankles in a circle. Good. Okay, go ahead and sit back down for me. Range of motion in upper and lower extremities is intact. Okay, now I'm going to have you push against me with your hands. Push. Pull. Good. Strength 5 out of 5. Push up. Good. Push up. Now push down. Good. Push down. Push down. Pull up. Right. Strength 5 out of 5 in upper and lower extremities. Symmetrical bilaterally. Now I'm going to do a quick assessment on your knees. If you could lay down for me. Right. So feel your patella. So the patella is present. Natural concavities noted on anterior aspect of each side above the patella. Now I'm going to apply pressure internally and externally on your knee. Okay. Good. Right, so no excessive laxity felt, no medial or lateral movement. Go ahead and flex your knee up here, just like that, okay? I'm going to do some pushing and pulling. All right, so no large amount of anterior or posterior movement noted. No signs of issues with the ACL noted. So the last thing we're going to do, I'm going to have you stand and I'm going to check out the range of motion of your spine. All right, so as noted earlier, inspection of the spine was within normal limits. Go ahead, bend over. I'm going to do some touching. Again, spine appears to be in alignment. No lordosis or kyphosis noted. No lumps, lesions, masses present. Okay, you can go ahead and stand. Now bend back. All right, forward. You can move side to side. Good, and then twist for me. Perfect. So spinal range of motion is intact. So that concludes our assessment. So thank you for participating today.